pulmonary circuit, and as we mentioned, the pulmonary circuit is supplied by the right side of the heart, right? And I want you to make sure that this makes sense for you. Don't just memorize it. The right side of the heart has deoxygenated blood. So it only makes sense that this side of the heart is going to send blood to the lungs, okay? The right side of the heart has your deoxygenated blood. So it's going to send that blood to your lungs to be reoxygenated. The left side of your heart is your freshly oxygenated blood. All right, this blood just came from the lungs. It has fresh oxygen in it, and it's going to send that blood now out to all your peripheral tissues to be oxygenated. So the pulmonary circuit receives blood from the right side of the heart and sends blood to the lungs. The systemic circuit receives blood from the lungs and sends blood to the rest of the body. Okay, now there's two descriptions or two types of flow when we talk about the circulation. There's series flow and there's parallel flow. So series flow means that each part of each area of circulation is happening one after the other after the other. And this is what occurs in the cardiovascular system. So blood has to go from the heart to the body, to the heart, to the lungs. To the heart, to the body, to the heart, to the lungs. Those things have to happen one after the other in series, okay? Whereas when we talk about the individual systemic circulation, blood does not go from the brain, then to the kidneys, then to the bladder, right? The blood in the systemic circulation happens in parallel. There's going to be branching network in the vessels, and blood is going to go to the brain. At the same time, blood is going to the kidneys, blood is going to the GI, blood is going to the liver, and that's what we call parallel flow. Okay, so there's series flow and parallel flow. Okay, so series flow, as you mentioned just now, is through the systemic and pulmonary circuits. Blood must flow through both of these. So it's going to happen one after the other, right? And one after the other in a series of events. To the lungs, to the heart, to the body, to the heart, to the lungs, right? And that has to happen in a series. Whereas in the systemic circulation, blood is flowing in a parallel flow. So blood is going to go to the lungs, right, as one option, to the brain as another option, to the liver, to the kidneys, to your muscles, your skin, and so on and so forth. So when we say parallel here, right, the blood has an option essentially. It's not going to one and then the other. It's sort of going to each of these areas simultaneously. Okay, so it's going to use those arteries, those arterioles, and those capillaries that we talked about. It's going to vascularize those tissues using the capillary bed. Then it's going to use the venules and the veins to make its way back to the heart in a parallel style of flow. Okay, let's look at this question. Okay, so in which way does most blood in the systemic circuit flow to organs and why? What is the style of blood flow that goes to the systemic organs, like your brain, your kidneys? What's the style of flow that we talked about? Is it in series? Does blood go to your brain and then to your kidney? No, right? It's parallel. So blood is going to go to your brains and your kidney at the same time. Okay, so they're not going to compromise each other. So it's going to be in parallel, right? Where each organ system receives fully oxygenated blood that can be independently regulated. So each of these organ systems are getting their own share of the cardiac output, their own share of blood from the heart. They're not depending on the brain to vascularize the kidney and so on and so forth. They're independent. All right, so as we talked about parallel flow, it's important for us to distinguish the blood supply of the heart itself, okay? So it's gonna be tempting or easy to sort of think that because blood is flowing through the chambers of the heart, that the heart will get oxygen from that blood, all right? That's not true. That's an incorrect assumption, all right? The heart has its own vessels, which are called your coronary vasculature or coronary arteries and veins, and they are going to come off of the aorta. So that very first artery we talked about here, the aorta, is going to give rise to the vessels that give blood and oxygen to the heart. So the heart does not take its nutrients from the blood within the chamber. Rather, the heart has its own set of arteries, arterioles, and capillaries, okay, which are external to the heart. And these are the vessels that get occluded and cause a heart attack. So if you have an occlusion of, let's say, your left anterior descending artery, which is the most common, you'll suffer a myocardial infarction, which is a heart attack, okay? So let's talk a little bit about the anatomy of the heart, right? The anatomy of the heart. So the heart is sitting in the center of the thoracic cavity. It's right in the middle here. It's slightly shifted to the left just because of the impression of the left ventricle. So the left ventricle is sort of impressing this way. And so the heart is slightly askew to the left. Now it's going to be sitting in between both of your lungs, right? Nicely nestled between both of those lungs and sitting on top of your diaphragm. So your diaphragm is this muscle here that separates your thorax from your abdominal cavity. All right, so above your diaphragm is your lungs and your heart and your major vessels. Below your diaphragm is all of your intestinal organs and such. Okay, now the heart is going to be about the size of a fist. Right, so the size of your fist is likely the size of your heart. If you have a bigger fist, you probably have a bigger heart, okay? And it's gonna be about 250 to 350 grams in its weight, right? Now, if you're an athlete, you also likely have a bigger heart, and we'll talk about why. Now, the heart is gonna sit in a sac or a cavity called the pericardial sac. And if you remember, we talked about 3 membranes earlier in the semester. We talked about the mucous membranes, the cutaneous membrane, and we also talked about your serous membrane. So we said the serous membrane was a double-walled membrane that had a transudate fluid, a slippery fluid, which allowed the heart or the lungs to move freely. So the pericardium is the name of that serous membrane that wraps around the heart. Okay, and it's going to reduce friction when the heart beats. The heart beats and moves. That sac, along with that fluid, is going to reduce friction and lubricate the heart. Okay. In terms of the walls of the heart, there are 3 layers, right? 3 layers to the walls of the heart. There's the epicardium, which is the outermost layer. It's an outer connective tissue layer that sort of protects the heart a little bit, the epicardium. Inside of that is the myocardium, and this is mostly the muscular, meaty part of the heart, right? The thickest part of the heart is the myocardium. And then finally, the inner lining or the inner layer is called the endothelium, right? The endothelium. So epicardium, myocardium, and endothelium. Now, the endothelium is going to be continuous throughout the entire vascular system. And it's actually an epithelial layer. So we talked about epithelia, and we said that there are layers of cells, right, that sit next to each other. And the endothelium is an epithelial layer, okay? And it's going to be continuous throughout all of the vessels of the heart, throughout all of the vessels of the body, as well as the heart, okay? And in the case of vessels, we talked about simple squamous being the type of epithelium, just to allow easy diffusion between vessels. All right, so let's talk a little bit about what happens when the heart beats. So what we appreciate as the heartbeat is actually the cyclical rhythm, right, of the heart emptying and filling, emptying and filling, emptying and filling, okay? Now, when it empties, the ventricles are contracting. Why? Because we said the ventricles are the pushing, right, or the emptying chambers of the heart. When it's relaxing, the ventricles are relaxing. They're getting blood from the atria. So there's that 1-2 sort of 1-2 beat where there's filling, emptying, filling, emptying. Okay, and that's gonna happen because of the different pressure gradients that it creates in the different chambers. So when pressure rises in the ventricles, right, the ventricle is going to contract and it's going to empty. When pressure is lower in the ventricle, it's going to relax and it's going to fill. So the chambers create a pressure gradient by which the blood wants to go from a place of high pressure to a place of low pressure. Okay, I'll say that again. The variations in pressure from one chamber to the other creates a gradient where the blood wants to flow from an area where it's under high pressure to an area where it's under lower pressure. If I increase the pressure in the ventricle, the blood is going to move from the ventricle out into the vessels because we've created a gradient by increasing that pressure. Okay? So the normal direction of flow is going to be from atria to ventricle, from ventricle to arteries. From atria to ventricle, from ventricle to arteries. Right? And in order to prevent the backflow, so it's very important that the blood in the heart maintains a unidirectional flow. In order to prevent backflow or leakage of blood, there are the presence of what we call valves, right? Valves. And valves are present in between chambers, as well as in between the ventricles and the vessel to prevent the backflow or the leakage of blood from where it just came. Right? So the ventricle just created all this pressure trying to get blood out and into the vessel. You don't want blood to be leaking back, right? Sort of undermining the work of the ventricle. So let's talk about those valves. There are 4 valves, right? 4 valves. The first 2 are called AV valves, and AV means that they are atrioventricular valves, right? Atrioventricular valves. And that means that they're in between the atrium and the ventricle. So they're preventing blood from moving from the ventricle back into the atrium. That's not the direction we want blood to flow, right? The first one is called a tricuspid valve, and that's because it has 3 cusps or 3 leaflets, right? A tricuspid valve, tricusp, okay? And the second one is called a bicuspid valve because it has 2 cusps or 2 leaflets. It's also called a mitral valve because it looks like the hat of a bishop, right? It has that shape. It's important to understand the way the valves work. So the valves are sort of ballooned like this, right? And when we talk about a bicuspid valve, it has 2 leaflets, whereas a tricuspid valve would have a 3rd leaflet here. Okay, and it's going to sort of dip into the chamber and prevent blood from flowing. So let's talk about the papillary muscles and the chorda tendineae. Now, the AV valves are associated with these 2 structures, the papillary muscle, which is a part of the ventricular wall, and the chorda tendineae. Now, chorda tendineae literally translates to tendinous cord, and this is a connective tissue cord-like structure that is anchored to the leaflets of the valve. So let's talk about what happens when the ventricle is nice and relaxed. So the ventricle is here, right? The atrium is on top here. The ventricle is relaxed, so the direction of flow here is blood is moving from the atria down into the ventricle. So this valve is open, okay? As a result, these cords are nice and relaxed. The papillary muscle is nice and relaxed. Okay? Now, when the ventricle is contracting here, this valve should be shut. When the ventricle is contracting, we're trying to move blood into the vessel, not back into the atria. So the AV valve should be tightly shut. Now, in order to prevent this valve from prolapsing back into the atria, now when I say prolapsing, if you shut that valve tightly, the pressure could push it right back into the atria, right? So the pressure of the ventricle could force these leaflets back up into the atria, which would totally be counterproductive to maintaining a tight seal. So the chorda tendineae are attached to the leaflets of the valve, and the papillary muscle of the ventricle is attached to those cords, and as the vessel contracts, the papillary muscle also contracts, and it's going to hold or pull the cords nice and snug so that that valve does not prolapse. Okay, I'll say that again. Contraction of the ventricle, right, allows contraction of the papillary muscle, and the papillary muscle is attached to the tendinous cords, and the pulling of the muscle on the tendinous cords prevents the prolapse of the valves, of the leaflets of the valves, okay? So it essentially maintains a tight seal, although the pressure is rising. All right, any questions on that? All right. The other two valves we have are called the semilunar valves, right? The semilunar valves. There's the aortic and the pulmonary. The aortic valve is found in the aorta, at the base of the aorta, and the pulmonary valve is found at the base of the pulmonary trunk, right? Those two vessels we talked about. So the aorta is leading out to the entire body circulation, whereas the pulmonary trunk is leading to the lungs, okay? So to prevent backflow of blood from that vessel to the ventricle, we have another valve here that is keeping a nice tight seal as those ventricles relax.